ready for another hour of my voice? Nobody's chiming in there. That was supposed to be funny. Okay. All right, so we'll get started right away. I'm going to start with the MRI of the ankle. I'm going to turn on my record button here. Okay, can you guys see the screen well? I try to move it up as close as I can. So what we're going to just do is we're going to pick it. There's an Owens left ankle that is in there. Okay, and I'm going to move my keyboard here. So notice there is an ankle protocol and a routine foot protocol, okay? So we'll throw the ankle protocol over. And the coil that we are going to use is going to be our foot and ankle protocol, our foot and ankle coil. There we go, and it is a sense coil. And we want to make sure all of the elements are turned on. So here is our 3-plane pilot. I'm going to check if there's another pilot that they did. Nope. So they only did one 3-plane pilot. If you do this full survey and you see both ankles, then you can go ahead and do your survey over the one or the left. So what we can do is position our slices right over where that ankle is at. It's not a great pilot scan here. And the very first thing that I'm going to have you sign up, artists, to pull up is going to be a sagittal, okay? So it's going to be a sagittal stir. And can somebody tell me, for a sagittal of the ankle, what do I want to angle with? Do you remember from lecture? What joint? All of those fun words. Yes, good job, Brad. So if I'm looking at my axial here, and I page through the axials that I can see, I know that right here is the tibia, and the fibula is over here, okay? So if I go up, I'm starting to kind of get into maybe the talus here, and I know the fibula is over here. So this is the joint. I'm going to put my middle line right over it. And this is the angle that you want to use. Okay? So I got my angle set. I do not have a real good coronal image off of this survey. And I don't have a great sagittal image as well, but if I go ahead and position this up straight, you can see that this is my field of view. Okay? And I'm going to position that right over where that ankle's at. I can see that this is probably the fibula here. So I know my ankle joint's going to be right here in the center. Okay? So we're going to go back to my angle, which kind of warps this field of view, but we like that field of view, okay? My slice thickness is going to be 3 millimeter at 0.5. I have 3 millimeter at 4.5 plugged in. This needs to be a stir pulse sequence, but first I want to go to how many slices do I need. And I know that I'm going to need to cover more because I'm not really skin to skin on this ankle. So I'm going to go ahead and plug in about 4 more slices here. And if you feel like that's even too close, because we don't have a lot of axials that we can page through to make sure we're not cutting anything off, you know, you can always add a couple more to be sure. And there, I have 20 slices that I plugged in. So I like my angle with the talofibular joint. I liked my field of view, which was a 150 by 150. Now I'm going to go to my contrast tab and pick my TR and my TE, turbo factor, and so forth. So I have a range from 1500 to 4000. And that would be fine. If you wanted maybe for a stir, maybe I would up this to, if I try 16,000, I'm just going to see if I can get this into one package. Not 16,000, 6,000 I should say. And it's still 2 packages. It's still going to leave my TR at 2,662, which is good. I'm okay with that for a stir. My TE is 60. I'm okay with that as well. I think in our book we're using around that 50 to 60 range, right? My turbo factors is 12, and I'm okay with that. You know, I think we've used what, up to 14 or 15, right? My TI is 140. I like that for a stir. So pretty much I like then how my weighting is. Okay, so let's go back to, this is a sagittal, and now let's talk about phase. What 2 directions of phase can I have to pick? Anybody want to chime in? Good job. A to P or head to foot. And either way, I'm going to have to turn on fold over, right? Because A to P, I'm going to have the toes wrapped. Head to foot, I'm going to have the lower leg wrapped. So technically, you know, it does not really matter what you pick because you're going to have a little bit of flow motion going A to P, and you got to have a little bit of flow motion going head to foot. So I'll let you pick which direction you want your face, but you do need to make sure that your fold over is turned on. Okay? Verify time and SAR. My SAR is in the normal range because I'm less than 2.0 watts per kilogram. My voxel, or no, my time is 4 minutes and 20 seconds, which is actually pretty decent for a stir, because generally stir sequences are like T2 weighted sequences where they are a little longer because our TRs are longer, right? Our matrix that we're using is a 0.6 by a 0.8. You can verify that. We've got 3 millimeters, and we have a smaller field of view of 15. So technically our resolution should be decent. So really 4 minutes and 20 seconds looks pretty good for this protocol. We can then click proceed and start. So now what's nice is I have a better sagittal that I can pull up. So now I can see my anatomy much better, right? So I'm paging through this set of series here. Okay? And if you're trying to page through these, and I'm going to blow it up for you a little bit here. If you're trying to figure out which is lateral and which is medial, then page through them trying to get it where it would keep my magnification for you. So as I'm paging through here, I notice that my fibula is here. So I know then that slice 1 is going to be from the lateral aspect, and now I'm paging through towards the medial aspect. Okay? So I'll go back to kind of more of the center slice here. And a lot of times, you know, you look for that center slice. If you can see this Achilles tendon back here, you're pretty much in the middle of your joint area, because that Achilles tendon is right back in the middle part of the posterior ankle there. So the second thing then, number 2 on our practical requirements, is to set it for a spare axial. Okay? So I can go ahead and pull up this axial PD spare. I can go ahead and position my field of view over the axial. Okay? I'm not going to do anything with my volume box yet. So according to our book, we want our slices to be parallel to the joint. So notice that the tibio-talar joint, this is the tibia, this is the talus, I'm right at that angle of the joint. So I can pretty much do straight axials. And I just want to make sure I cover above the ankle joint all the way through the bottom of the ankle into this skin area. Okay? So I'm going to get all of the calcaneus. I'm going to get some of this plantar fasciae. I got my Achilles tendon. And as far as field of view goes, you know, some people say, well, how much do you cover into the foot? But if you are into the metatarsals, you are good. Okay, so I have a field of view A to P 160. We can probably bring that down to 150, because as I page through my sagittals here, I can see my long bone starting. I know that's into my metatarsals. And many times what doctors will say is that make sure that you include just that base of the 5th metatarsal, which is right here, because this is that very first, this is our first slice on that lateral side, and this is the base of the 5th metatarsal. And I know these are, it's driving me nuts. They go magnified and then they don't. But so your field of view here, you know, I'm in that 150 range. If you decide to make yours a little smaller to 140, I'm okay with that. I'm doing an axial, so I have an A to P and a right to left. Okay? And right to left looks pretty good. Okay? So my slice thickness is 4 at a 1 gap. My field of view I like here. I coned in a little bit left to right here, because if I'm going to go ahead and take my fold over direction, I can go A to P or right to left. And technically there really isn't anything right to left, but you do have to think about that other foot, because there are some coils that's going to pick up signal from the other foot that's lying beside it. So if you choose right to left, you're going to need fold over. Even if you choose A to P, because you're going to have the toes, as you get down into the slices lower in the ankle, you have to worry about the toes wrapping in. You're going to want to pick fold over. So whether you do right to left or A to P, and I don't care what you pick, but I want you to understand, if you pick right to left, I'm going to say, well, what are you worried about folding over? And I want you to say, well, I'm worried about the other foot. Or if I pick A to P, I'm going to say, what are you worried about being folded? You know, what are you worrying about wrapping into your image? And I want you to tell me, well, the toes could wrap in. So it's just that you understand what you pick and what are you worried about. So hopefully you understand that. Okay. So I'm going to now go to my contrast, and I'm going to tell you whether or not I want a PD or a T2. So let's just say I want you to set me up a T2 spare. You're going to then go to the TR and say, well, I'm at 3,000. My TE is 30. Oh, I want this to be a T2. So I'm going to probably go up to probably a 85 to 100 here, right? Therefore, then my turbo factor can be kind of like a 22. I have 4,000 TR. It's at 2 packages. I'm at 2 minutes. That looks great. Because with this only being 2 minutes, I can go to my motion tab, bring it up to 3 necks. It's only 3 minutes, and I've just added more signal to my pictures. Okay? Does that make sense to you guys? Yes? No? My voxel size is a 0.5 by a 0.6, so actually that's pretty good. Anything below like 0.7 is pretty much good, a good range for resolution, okay? Yes, we are doing T2. So I have 4,000 at 100, a 22 turbo factor. I'm going to go back and now turn on my volume box and position that over where my slices are. I'm going to open it up A to P because I really still want all of my anatomy to be saturated. So that looks good. Even up over here, you feel like you want to bring it in this way, I'm okay with that, but you don't really want to bring it in A to P because you still want the tarsal bones and even into this proximal metatarsals to be saturated. Now I'm going to go to my spare TR, and that's down here. I have 80, it's at 308. So if I want to get full saturation, I want to be at a third, so I'll just go 100. We already talked about phase direction. Do you want a rest slab? You know, you don't have to. There are some techs that I've seen that likes to put on a rest slab. And what they'll do is they'll take a rest slab and they'll just put it above the slice stack for the arterial flow that's coming down. You can or you can't. Again, you're the technologist. It's 3 minutes and 16 seconds. Do you like it? Yeah, I like it. So we can hit proceed and start. Now again, I did up my necks. When you guys are planning as a technologist, and if you notice that your scan time is not that long, you've got time to make this picture better then. So you can either make it better by giving it more resolution or giving it more signal, or maybe you're going to even try both. I'm going to say I can go down to maybe a 0.4 by 0.4, and then it's 3 minutes, and maybe I'll go up to a 3 necks, and it's 4.5 minutes. It's not terrible, especially if you have a good patient that you've got, 30 minutes to scan this patient in. So this is where it's up to you to kind of play. Proceed and start. So now I have a better axial that I can pull up. This is a coronal. Series 4 is my axial, okay? let's see what 5 is. Oh, that's another coronal here. Okay. So I'm going to pull up this better axial. There we go. Now I'm going to do a stir coronal. I can position this over here. Bring my slices down. Okay. Now remember when we did the sagittal, we went right through that talofibular joint here, right? Okay, because I know this is my fibula. I know that's my tibia. And we were parallel. So now we're going to go ahead and be perpendicular. So I'm going to go perpendicular to the talofibular joint. I'm going to pick my center sagittal slice where I can see my Achilles. And depending on how this ankle is situated, some people might say they're going to angle it kind of with the angle of the Achilles, or even maybe at the angle of maybe where this tibia is. But I definitely know I need a lot more slices, right? So I'm going to pick 3 at 0.5 because that's what my paper's telling me. That's my protocol. Okay. And I'm going to need a whole lot more slices. So I picked 25. I might even go up to 30 slices. I'm going to bring it a little forward here. I have from the Achilles tendon all the way through my ankle joint. This is my talus. So now we're into those tarsal bones here. And if I page through these, I've included to the base of the 5th metatarsal. Okay? So I think that looks pretty good. You can turn your slices back on here so you can see how you're slicing. This is a stir, so I'm going to go to my contrast. I have the shortest TR I can use is 4,170. 140 TI. Our TE's at 30. I think we are using around that 60, weren't we? Now, my time's 7 minutes. Whew, that's kind of long. I can go to my motion tab and I can drop my next down to 3. I also have a sense coil, so I can turn on my sense coil. I'm going to have to make sure I have the sense coil picked. Where did that go? There it is. That's the reason why I'm getting the conflict, because it says you don't have the sense coil on, or you're not utilizing it. So if I go ahead and turn on my sense, I can maybe go to 1.3, and I've got it down to 4.5 now. That's actually pretty decent. I'm doing a coronal, so I'm going to look at my coronal viewport, and I can go head to foot or right to left. And it's just like the axial, where I'm either going to have the lower leg wrapping or I have to worry about the other foot wrapping in. Okay, so you can pick right to left or head to foot, but make sure you have fold over turned on. Okay, verify your time in your SAR. I'm at 4.5 minutes, and I'm at first level. I'm at 2.2 watts per kilogram. But you know what? I can scan this because my patient does not have a heart valve or a heart stent or some card telling me to only scan in normal operating mode. Okay? So if by chance your patient tells you they have a card or they have something, then you're going to have to go to your SAR mode and change your SAR mode, which is under your contrast, down to maybe if I go to moderate, yeah, now I'm at normal operating mode, which is less than 2 watts per kilogram or less. The matrix that I'm using, I have a voxel size of 0.6 by 0.7. It gives me a 268 by a 181 matrix. That looks good. If I ask you that I want a higher matrix, then you need to show me how you get that. So if I want this number to be higher, which would give me more resolution, I'm going to go down in my voxel size. So if I go to a 0.5 by 0.5, that changed to 0.4. Now I'm at a 320 by 306. It's going to get me a lot better resolution, but it's going to suffer in signal, right? And then it also costs me more time. So then you have to go back and think, okay, well, maybe I can do a 1.5 in my sense. Or, you know, that's where you're doing your plane, okay? It's just that you understand how all of these factors kind of come into play. And if you understand parameters, then it's very easy to change things, you know, make your time faster and still get good images and still get good resolution and try to keep your signal and so forth, okay? To let you know though, in the real world, many of this is set for you. They've already maximized this and you only need to kind of tweak it a little bit. We teach you from kind of bare minimum from scratch, but in the real world, you're not going to have to be manipulating all of this very often because we've already kind of maximized this protocol for the liking of the radiologist, okay? So we can click proceed and start. Number 4 says that the radiologist is requesting a T2 spare coronal oblique for the PTT, right? Posterior tibial tendon rupture. This is not part of the routine, so you have to create it from scratch. And what would you do? Well, there's a couple things you could do. I could go back to my protocol and I could find maybe under the foot, maybe I can find a T2. Nope, don't see one there. Let's see if the hip has it. Well, there's an axial T2 fat sat. I can just turn off fat sat. You could pull that over. You know, you can pull over anything and create a protocol. Or you can take this axial PD fat sat spare. You could copy it. You could paste it. And then you can go ahead and line this up. And how I would do that, when we do these coronal obliques, we're going to angle it with the PTT. And where is that at? Okay, well, first of all, let me get these slices off of here. I'm going to move this up. As I page through this set of sagittals, can somebody tell me, is the PTT medial or lateral? Guys, remember from lecture, is the PTT, posterior tibial tendon, lateral or medial? Great, good job. And it is medial, and if you think about it, oh, it's the posterior tibial tendon. The tibia is on the medial side, so it does go medial. Well, I remember that my very first slice, I was into the fibula here, so I now need to go to the entire other side, okay? And it is this tendon here, you kind of lighten it up here. It is this tendon that I'm looking at. So now I bring my slice down and I'm going to go about a 45 degrees to it, right like that. Once I get my angle, I can now go to the center here might just cover this entire joint. I'm going to get this posterior tibial tendon that starts up here on the medial side, which is right there. And I'm going to be able to follow that tendon as it comes down. Okay? So once I have my slices angled the way I want, let's go back to my parameters here. I have a 150 by 113, and that's pretty good. That's still a pretty good field of view. I'm going to keep it at 4 millimeters by 1. Because this is considered more of an axial oblique here, the two directions that I have of fold over is going to be A to P and right to left. And again, you can pick, but you will need fold over turned on because you have to worry about that other foot, or I have to worry about the toes if I go A to P. It's built in here with a rest slab. So let's just say if you want to keep it, maybe you can even move that up a little bit. You know, you're only cutting off just that part of the anatomy here. Or you can turn it off. Either one's fine. Okay? I want it to be T2. Well, guess what? Earlier I wanted this to be T2. So I already have 4,274 TR, 100 TE. I have a 22 turbo factor. I like that. My spare TR is 100 and it's 328. I like that. You're good to go. Now I just got to make sure that I position my volume box to be within my slices here. Okay? And you're good to go. It's 4 minutes, 25 seconds, which is good. That's a good time. I have a 3 next. That's great. Especially for a T2 in a stir. If you have a 3 next or higher, that's a good next to have. Proceed and start. And that's how you do an ankle. Any questions on understanding anatomy or so forth? I am going to pull up that this is what a coronal would look like. So here is that ankle mortise that we talk about. And in the real world, when we were setting up our slices here, we would have had a better coronal to look at. Okay, because we could have done another localizer right through the coronal. This localizer was done probably right through the more of the foot area and not back of the ankle area. So in the real world, you would have had a better coronal to look at. Does that sound good, guys? You guys ready to move on? Perfect. Okay, so I'm going to go ahead and clean up here. I'm going to go ahead and get my practical requirements for the foot. And then I'm going to find my foot image. There is a foot here. I'm trying to think how many, if I have any other ones in here. There is a left foot in here. And I think so there looks like there's a left foot and the left ankle, and then there's a right foot. So depending on, just think of that when you're doing your practicals. Are we doing the right foot or are we doing the left foot? Where is your patient having their problems from, okay? So I pulled over the right foot here. This is the right foot protocol. Okay? Or the routine foot protocol, I should say. And we're going to use that same coil. We're going to use the sense coil. The sense foot and ankle coil. Proceed and start. Oh, I don't have any images on here. Nope, okay, so let's go back here. I need the one up higher. Sorry about that, guys. Okay, so we already did our full field of view, and what this is doing is kind of almost giving me two surveys here, so I'm going to delete the second half here. There we go. Got to go back to my foot and ankle sense coil. There we go. So I have a sagittal, don't have really anything in the there we go. I have a long axis view here, but I don't really have a short axis view, do I? Because that's kind of almost looks like it's in air. So we can do another, well, we're going to do the survey here of the left or the right. So if we're going to do a right, I'm going to go ahead and just take a slice now going right through the center of these metatarsals, because if you notice, I'm looking for the attention to the second and third metatarsals. And I'm going to get a good short axis and a good long axis image right here. Proceed and start. So now I can go, and I got a pretty good sagittal. Here would be my long axis view. And notice like the foot's kind of like rolled in there, right? Kind of turned in there. And here would be my coronal, although this coronal is more at that ankle where it only makes sense. And again, I only have these images that are available to me, but it would only make sense that my short axis that I put right through the metatarsals, that would be what would be on this viewport. Whoever scanned this particular case, they left the short axis back here in the ankle, but we're really, you can put it here and get a better short axis. So you'd have your long axis, your sagittal, and your short axis. But that's okay, because we're going to start with the short axis sequence, and then we're going to replace this particular viewport, okay? So we're going to go, and notice that this was built with sagittals first, with the short axis, and then the long axis. So you have the availability to say, you know what, I'm going to go ahead and do my short axis pictures first. So I'm going to pick this one. I'm going to position it to be perpendicular to my metatarsals, right? Well, my metatarsals are at this angle, that long bone of the foot, and I want to be perpendicular to it. So I'm going to angle right like that. Okay, I'm going to take this and put it over in the center. Do I have a field of view box that can show up onto my short axis? Not really, because I'm almost back too far, okay? But I do want to add some slices. My field of view is a 160 by right to left 130. So This would be where your field of view box would be to look at. I'm going to get rid of my volume, put it up here for now. But right to left is 130, and I could probably bring head to foot down to, let's try a 130 here. So you see, I can do a 130 by a 130. And if I look over here, I have the entire mid-foot covered as far as my field of view goes. Now, I can see here's my first metatarsal, and then it's kind of like you can barely make out these other ones. So I'm going to add some slices here. It's telling me to do 3 millimeters at 0.5. So I have 3 millimeter at 0.5. So I want to go ahead and add about 5 slices here. And by doing that, I am starting, well, here's number 1. So I am actually starting in my phalanges. And then I'm going all the way and I'm ending, and I know here's my cuboid bone. So I have the entire metatarsals included, right? And that looks good. Okay? So my field of view looks good. I can bring my volume box back in, and I could even take some of the air out because I'm just going to want to get over my foot, right? There we go. It's a PD spare, so that means I need a high TR and a low TE. It's on the shortest, and that shortest TR with 30 slices is 6,624. My TE is 30. I like that for a PD. My TSE is 13. That looks pretty good. I think sometimes we're in that, 10 to 15 range. It's only 3 minutes, okay? My spare TR is 80. Or my inversion delay is 80, my spare TR is 220, and that's pretty close because 8 times 3 is 240, right? If you feel like you want to be perfect, you can change it to like a 75, but that looks fine. My phase direction, I have to look back at the image over here because I have head to foot or right to left. Again, whatever you pick, you're going to need fold over because you've got that other foot that can wrap in, okay? So I have picked right to left, and I got to make sure that fold over is turned on because I don't want any wrap. It's 3 minutes, looks great. I like it. Start. Now I can go ahead and take this short axis image, okay, which is actually series 9. So here's my short axis images, right? So you can replace that. Now you've got a good short axis right through where your metatarsals are. And I'm going to set up for a stir long axis. And that's over here. There we go. Okay. Got it over into my foot area. You want to straighten everything to see your field of view box. That looks good. If you feel like you want to make it a little smaller, because again, I'm really only interested in getting all of my metatarsals. So if I'm in the phalanges and if I'm all the way through my cuboid, I've got all my metatarsals in the very middle of the slice, or the middle of the field of view. 3 millimeters at 0.5, 3 at 0.5. Okay. Now, here's where I'm going to put the double angle in. I'm going to angle it off of my sagittal to be parallel here with those metatarsals. Over here, I'm going to angle it like I'm taking a slice through the very first and the fifth. And you can kind of page through here to kind of pick how you want it there. Okay. And I probably want to add a couple slices because I'm right on the edge there. Okay. I like that. Again, phase direction, I'm setting up a long axis, so I have A to P or right to left. Either way, I'm going to need fold over. Fold over is turned on, and you tell me what you want, A to P or left to right. Verify time is 4 minutes and 41 seconds. I have normal SAR. If I feel like I want to go ahead, my matrix is 220 by 174. If I feel like that's a little long, but it's a stir, and stirs are normally long. Drop your next down to 3. That's still pretty good. Now it's 3.5 minutes. Proceed and start. Now I can pull up a better long axis, which is here. This is my long axis view. Okay. And notice this isn't done perfectly with this double angle, but what you should be able to pick out is a nice picture, excuse me, of these metatarsals. Well, I know here's my big toe. I know here's my first metatarsal. As I page through here, I know there's my second. There's the head of my second. And I know here is the start of my third. So when I'm setting up for, the third, number 3 is a T2 long axis, and you're going to set up number 3 the exact same way you set up number 2 with that double angle. I'm going to jump down to number 4 on our practical requirements because I'm telling you that it's showing osteomyelitis in the second and third metatarsals. So here when I do my T1 sagittal, that's where I'm going to look at my second and third metatarsals and angle it so I have a slice going right through those long bones. So do you see how that angle that we choose here is going to go right through the second and third metatarsal, so I can hopefully get in one plane the head of the metatarsal and the base of the metatarsal. I can straighten up this field of view. Okay. Field of view doesn't look too bad. If you feel like I don't need all of this because I'm only looking at the metatarsals, I'm only looking at the midfoot. If we go to a 130, I'm into the calcaneus, I'm into my phalanges. I should get the entire metatarsals on my pictures. Okay, I can put them in the center there. I can go ahead over to my short axis and angle this way. And I know I'm going to need to add some slices. I'm going to do 3 millimeter at, so it's default 0.5. Okay, I'm going to add some slices. And if I page through these sagittals, I should pretty much get the entire second and third metatarsal. Now, if you're saying, yeah, but you're going to not get the fifth one, well, if you feel like you have to include it, add more slices. But if we're truly only looking at the second and third metatarsals, then you're good to go, okay? So either way, now some places might say, yeah, but we can cover all of the foot. Okay, that's fine. Add a couple slices and you should be able to page through. And you've pretty much got all of them on there then. Okay. So I can turn my slices back on. So this is a T1 sagittal. With it being a sagittal, I have a head to foot or A to P. Now again, this is where it's going to be, you know, head to foot. You're going to get a little bit of this foot, maybe, or the lower leg maybe wrapping in here on the very end here. if you move this forward, and if you're going to do something like this, technically there is just air head to foot. You would not need fold over. But if you have it back enough where you have some of that lower leg in your field of view, a head to foot you're going to need fold over on. Okay, so if you're going to go ahead, and then even if you do A to P, you're going to need fold over because you're going to have the toes and the heel that wrap in. My time's only 1 minute and 27. If you only have 1 minute and 27 scan and you have a good patient on the table and you've got the time, why not make it pretty? Go up to 3 necks. Bring your resolution down. Give it better resolution. I'm now at 3 minutes, which is still doable. I've got better resolution and I even added signal back in. Okay? My SAR is normal. My time's 3 minutes and my matrix is a 332 by 260. Looks great. And go. Does that make sense to you guys? How's that sound? Sound good? Okay. Very good. So what I just wanted to kind of real quick here go through is some anatomy, because as I'm looking at this long axis view here, once I know that this is my medial aspect of the foot, I know that this is my first, our distal phalanx of the big toe. This is my proximal. This is my metatarsal. Right behind that first metatarsal is your first cuneiform. Okay, right here. And then as we page through, oh, I'm sorry, page to the other way here. So we've got 1, we've got 2. Hard to tell where that third is at. Oh, here's the third. Here's the right not posterior, but proximal again to the foot. So I have my first, second, and third cuneiforms, or the medial, intermediate, and lateral. This is my navicular. So I page through here. The large bone on that base of the 5th metatarsal here is going to be my cuboid bone. And notice how you can see then these tendon strands, right? Those dark strands underneath the foot. Then I was going to pick up a sagittal plane for you. So in the sagittal plane here of the foot, our goal is to be able to see the head and the base of this long metatarsal like in one image. And see how we can then kind of almost see it, the next one here. It's not perfect, but this way if somebody has fractures, you know, hopefully we can pick them up nicely. And down here, you can see that part of the sesamoid bone because that is like that little P-shaped structure. I don't know how well this is showing up on your, I'm trying to window it so you guys can see it better. And then on, so this is a stir sagittal. And then on these short axis images, what many times, you know, that doctors are looking at, you can see we're part of the one sesamoid bone here. Part of one there, you can see where there's that dark ligament or tendon that goes right through that. But on this plane, many times, you know, they're looking at structures like between the metatarsals within this soft tissue. Okay, so that is basically it, how to set up for an ankle and a foot. Any questions?